as we're going to start with this EPE session organized by the Gender, Disability, and Human Rights Working Group. Our colleague Nick Cowbell is the host today. So, Nick, the floor is yours. Thank you.
All right. Thank you. Thanks very much, Sabas. Hi, everyone, and welcome to our session, our UNEG EPE, launching the UNEG guidelines for disability inclusion in evaluations and reporting on the UNDIS accountability framework. It's very timely, as right now it's March, and we're organizations are working towards that March 31st reporting deadline. First up, I'd just like to say it's my pleasure to welcome everyone to this official launch. I'll just make a few brief remarks and then turn it over to our presenters and panel members. You know, UNEG had worked with the USG disability team on the technical guidance for Indicator 10 on evaluation, which was about 2 years ago. This session we hope will be timely for you as well as you begin your reporting. This is a new area of mainstreaming for most of us, if not all UNEG evaluation teams. So the gender, the GEDHR working group at UNEG, led by Tara Call and Sabas Monroy, with financial support from the UNDIS Secretariat, commissioned the development of this guidance to support implementation of the UNDIS evaluation indicator. So you will see that the focus of the guidance presented today is very practical on approaches and tools to meeting the UNDIS requirements for disability inclusion, gathered from good practices across the UN system and in evaluation units outside of the UN, including organizations working with persons with disabilities. We've collected the examples in the guidance directly, so you'll be able to rely on these and find them useful. Maria Cano, of course, our lead consultant on the project, will present these to you. While this is a final document, we expect that this guidance will evolve as well as the UN system becomes more proficient in this area. It's a new mainstreaming issue for many of us to include. And as we gain experience, that experience can be shared through UNEG as well. We consider this guidance, therefore, a very practical first step on the journey to better including disability considerations in our evaluations. So without further delay, I'd like to introduce and thank the presenters today. First up will be Gopal Mitra from the EOSG Disability Strategy Secretariat. He will give an overview of the UNDIS, which applies to all United Nations funds, departments, and agencies, and focus on the implications for evaluation. Following from that, we will turn it over to Maria Cano, a senior consultant that developed the UNEG guidelines that we're presenting to you today, and she will present an overview of those guidelines for you. And then we'll have a panel discussion from evaluation colleagues Catherine Aston of UNODC and Naomi Sukai of ILO, where we'll discuss the journey of their respective evaluation shops at incorporating disability inclusion into their work. If you have any questions for the panel or presenters, colleagues, please feel free to pop them in the chat. Tara Call on our end will be collating these and we'll make sure to use these in the question and answer session towards the end. Just very quickly, some acknowledgements. Of course, Maria, who helped with the develop the guidance, financial support from the UNDIS Secretariat, and all of the members of the UNEG working group that supported this. Thank you, colleagues, for your help and thoughtful guidance on this. Also, one final note that this included consultations with individuals and organizations, including those of persons with disabilities. So to acknowledge that as well. Without further talking from me, I will turn it over to Gopal. Gopal, we're on your first slide.
Thank you, Nick. Great, and thank you so much, colleagues, and thank you, Sabas and Tara, and to you, Nick, for giving me the opportunity to briefly present today and giving an overview of the UN Disability Inclusion Strategy, and to all of you colleagues for this time to reflect. So we are deeply appreciative to all of you advancing the area or advancing the work of integrating disability into evaluations, which is one of the foundational ways in which we can track how UNDIS is delivering also. When we look at the evaluations in terms of how disability inclusion is reflected or it has been integrated, we can have some key lessons from there, which we can factor in when we, as we go along with the implementation of the UN Disability Inclusion Strategy. So just to come on to my slide, Nick, if you can have the second slide on on persons with disabilities in the world.
Yes.
Just before we go into UNDIS, the UN Disability Inclusion Strategy, which is called the UNDIS in short, as we go into it proper, just a couple of key snippets here, persons with disabilities in the world. If you see there, 15% of any population are persons with disabilities, which means there are more than 1 billion persons with disabilities in this world. That's a significant number. And 1 in 5, or about 20% of women are women with disabilities. 1 in 10 children, or 10% of children, are children with disabilities. Persons with disabilities, whether it's children or adults, are more likely to be excluded from education, more likely to live in poverty, less likely to access healthcare or livelihood opportunities, and again, more likely to experience violence, neglect, and abuse. In terms of humanitarian emergencies, persons with disabilities are disproportionately impacted by humanitarian emergencies. If you have been following the news in Ukraine, there are several news articles or items that have come up during the last couple of days showing how it is being difficult to reach supplies to persons with disabilities. Bomb shelters, evacuation sites are inaccessible. So in terms of taking safeguarding, in terms of evacuation, it's a problem. So it's disproportionately impacted this group, persons with disabilities, whether it's children or adults. Coming on to the next slide, Nick. The UN Disability Inclusion Strategy was launched in June 2019, so about 3 years back, by the Secretary General to bring about lasting and transformative change in the work of the UN on disability inclusion. If you see, the strategy has a wide-ranging scope. It covers both programs and internal operations. It covers all the 3 pillars of the UN's work: development, human rights, peace, and security. And it's applicable both to our work in the headquarters, in the regional offices, as well as at the country level. The policy, the strategy, the UN Disability Inclusion Strategy consists of 2 components. One is a policy which outlines the overall vision and commitment of the United Nations system to persons with disabilities. And the second component is the accountability framework, which has 2 elements. One is an entity accountability framework, which we'll be focusing on today mainly, and the second is the UN country team scorecard. So the UN entities implement and report on the UN entity accountability framework, and UN country teams implement and report on the scorecard. Both UN entities and country teams report annually on their progress, and based on the reports, the Secretary General submits a report to the General Assembly every year on the progress that is being made on UNDIS implementation. Now, if you see, the strategy will support the achievement of the SDGs for persons with disabilities for more than 1 billion people, as well as the implementation on the UN Convention on the Rights of Persons with Disabilities. Now, coming to the strategy proper. So the accountability framework, as I told you, the entity accountability framework, which the entities report and implement and report on, it consists of 15 performance indicators clustered in 4 core areas. And given that the entities are at different starting points in their journey to include persons with disabilities in all their work, the entity accountability framework has been designed in such a way that it factors in the progressive realization and improvement in performance. So there are 15 indicators. The first core area is leadership, strategic planning, and management. You can see the indicators there. The indicators on whether the leadership champions disability inclusion, whether there is a disability specific policy and strategy within the entity, what is the institutional setup, whether it has the expertise or not, and so on. The second cluster or core area is inclusiveness. In that, there are indicators on accessibility, whether our premises are digital products, our online platforms, our communication, both internal and external, are accessible or not. It has indicators on consulting organizations of persons with disabilities, which is, I think, foundational if you want to advance disability inclusion. There are indicators on reasonable accommodation, on procurement, how disability inclusive our procurement is. The third cluster, and that is what is important also to our discussion today particularly, consists of indicators on projects, programs and projects, to what extent they are inclusive. The indicators on evaluation. The indicator is here, indicator 10, and we will go to that into a little more detail. There are indicators on joint programming and so on. The fourth cluster is organizational culture. As I told you before, the strategy covers both programs and operations. So this, of course, accessibility of our premises is dealt by colleagues who are working in operations. In the organizational culture, that is the fourth core area, there are indicators on employment of persons with disabilities, on capacity building, on disability inclusive communications, and so on. So all these indicators, they have benchmarks, and we will specifically go into the evaluation indicator. And like the gender system-wide action plan, there are indicators on a progressive scale on approaching the requirements of an indicator, on meeting the requirements and exceeding the requirements. And there is also, if you don't approach the requirements, it's missing the requirements. So the benchmarks for meeting requirement will be little more stringent than the benchmark on approaching requirements and so on. Now coming to the evaluation indicator particularly. So the evaluation indicator based on which the guidelines have been developed, if you see, it has approaching requirement, meeting requirement, and exceeding requirements like all other indicators. To approach the requirements, the benchmark is evaluation guidelines are there, and they include how persons with disabilities can be integrated into the evaluation guidelines. To meet the requirements, of course, you have to satisfy, the entities have to satisfy the first element, that is evaluation guidelines integrating persons with disabilities into evaluations is in place. And in addition to that, entities would need to implement and work towards ensuring that the evaluation process, in preference, the inception, the findings of the evaluation process, it integrates or includes persons with disabilities in a substantive and meaningful manner. And to meet the requirements, that is what entities will have to do. These are the two components. To exceed the requirements, in addition to having evaluation guidelines and ensuring that evaluation processes integrates persons with disabilities, there is an additional benchmark which says that a meta-analysis of how persons with disabilities have been integrated into evaluations in the inception report, in the findings, in the recommendations, that has to be carried out once in 5 years. And it's based on this that the evaluation guidelines that Maria will be talking about, and with which this working group has contributed to, will essentially deal with. Now, I told you that entities report once a year annually on the performance. So based on the last two reports, let me give you a snapshot of what the performance looks like on the evaluation indicator. So if you see on the slide, for the evaluation indicator, we have data for 2019 and 2020. Yes. So in 2019, most of the entities, if you see indicator 10, their evaluation, 67% of entities were missing requirements, means that they were not even approaching the requirements. And but we have seen improvement in 2020. 37% are missing the requirements. So entities have moved from meeting to approaching requirements. If you see approaching requirements, it's 31 and 55. So in 2020, right now, 55% of entities are approaching the requirement, which means they have in some way integrated disability inclusion into their evaluation guidelines. But if you go above that, you see the aim is for all the entities to meet the requirements of every indicator. And if you see it, we are quite behind there. Currently in 2020, only 8% of entities are meeting the requirements of the evaluation indicator, which means integrating persons with disabilities in the or including persons with disabilities in the evaluation process. And no entity is exceeding the requirement. That means no entity as yet has carried out a meta-analysis. So this is where the system's performance stand. And we do very much hope that with this evaluation guidelines and with all your efforts, we will be able to move all the entities from missing to approaching requirements, and a significant number of entities from approaching to meeting the requirements. Before I end, I would like to give you a personal reflection. For the last 6 or 7 years, I have been I have participated in many evaluations of the UN system, particularly looking at the persons with disabilities, or have been asked to reflect on persons with disabilities. The latest is I'm part of the high-level advisory group, which is currently for the current evaluation on the interagency humanitarian evaluation on COVID-19. While I was in UNICEF, I have done that. So one of my key takeaways is that when we speak to our evaluators, for evaluations, most of you hire firms, consultants, and so on. For the last 5 at least, when I spoke to the consultants, what is very positive I found is most of those consultants in the past have looked at disability inclusion in evaluations. So you have, whereas maybe the UN has not systematically integrated this as yet, but there are a whole lot of evaluators out there, at least last 5 I have spoken to, and disability was an afterthought in many of those. So it was disability inclusion was not kept in mind when these firms or consultants were hired. The evaluation team was hired. But luckily, I found almost all of them in their prior, efforts have integrated or tried to look at disability inclusion through data, through focus group discussion. Some of them have produced case studies as part of evaluations and so on. So there is a wealth of knowledge there, and we are, as Tara and Sabas and Nick knows, we are always there to provide any sort of reflection, any technical support that you all may require. So I'll stop there, and thank you once again for giving the opportunity. If there are any questions, would be happy to respond. Over to you, Nick, and thank you once again for also helping me with the PPT.
Of course, and thank you very much, Gopal, for taking some time out of your well-earned holidays to speak with us this morning and this afternoon. Your overview of the UNDIS, the scope of the UNDIS, and the progress that we're seeing on implementation, but of course still a ways to go on the evaluation indicator. Even with your positive reflections on the growth of that practice. So thank you kindly for that. Put up here for everyone. There is all the UNDIS information is available at this website here. very helpful resource. And with that, I will turn it over now to Maria Cano, our chief author of the guidance and consultant that led this project. Maria, over to you to tell us about the UNEG guidance on disability inclusion.
Thank you for giving me the floor. Thank you, Gopal, for the introduction. And I guess that all of you have received the guidance document. So I'm just gonna walk you through it and happy to respond questions at the end as well. So the first thing that we did was to have a brief section in the introduction on why evaluation is critical to disability inclusion, right? And it's important that I think actually that was that was part of the discussion in terms of this is something that it's clear maybe for all of us sitting in this call, but that it's important to remind those consultants that Gopal was talking about why it makes a difference in the quality of the evaluation, why it makes a difference for the persons living with disabilities, that they have a voice and that they are consulted and that we evaluate all programs, policies in terms of how disability inclusion is integrated in evaluations. We introduced the guidance talking a little bit about the CRPD, the SDGs, and this motto of nothing about us without us. So we consulted organizations of people with disabilities for this guidance. And we collected, and thank you for, I know that some of you are in the call, thank you so much for sharing tools and examples of good practices that we have to the extent possible reflected in the guidance. So the question that we first asked was, if we know that it matters, if we know that evaluations will be better by integrating disability inclusion and therefore programming will be better, why is it that we're not yet doing that? And Gopal showed us the picture, so it's very clear that we have a long way to go. We collected some of the responses that we hear more often. The first reason was that disability inclusion is to be integrated in evaluations of disability targeted projects only. And very clearly, the UNEG guidance says that it has to be for targeted projects and for every other projects where disability should be mainstream. Another argument that we hear often is that to integrate disability inclusion in evaluations, we need a disability expert. And that is correct. At the same time, we can find creative solutions, and disability inclusion is about thinking outside the box and looking for creative solutions to all these different arguments. And therefore, we suggest that we, for example, can consult UNDI's focal point in different agencies. Another reason is that there's no OPDs, organizations of persons with disabilities, working in different countries. But we see here that there's more and more OPDs that can provide a good overview of the situation, as well as data, context, methodologies, services, etc. Another argument, consultations with most vulnerable and hard to reach populations, including persons with disabilities, are costly, time-consuming. Donors are not asking for it, or there is scarce data. So we respond briefly to all these different arguments, providing practical and out-of-the-box ways forward to integrate disability inclusion in evaluations. So we look at the evaluation indicator, and Gopal has already presented it. So if we move to the next slide, we then provide guidance on how to approach, meet, and exceed the requirements. So we list the 6 elements, and then we go in detail element by element with practical ways, tools, and good practices on what to do in order to integrate disability inclusion in each of those elements. So if we look at the first one, the first one says that the terms of reference for evaluations need to pay adequate attention to disability inclusion. So, for example, in the terms of reference, we advocate for, in the background information, to provide a brief description on how the project or the initiative takes cross-cutting issues into account in the design, implementation, including disability inclusion. But this needs to be integrated also in the purpose. And this element has to do with the evaluation teams having knowledge and or experience of disability inclusion where relevant. So, for example, creating a database or a mailing list of evaluators, and Gopal, you were talking about that, or consultants with knowledge and experience of disability inclusion that we can share internally and with other agencies and entities. In the profile section for the selection and recruitment of the team, to also require that knowledge and experience when screening the candidates, and then also inviting a UNDIS focal point or disability expert in each agency to the reference group, or at least consult them when the evaluation is being prepared. For the next element, and this is a very important one, which is to do with the evaluation questions covering different aspects of disability inclusion. And here we prepared a little table with examples of how you can either keep the same question, evaluation question, and add disability inclusion in that question, or add new questions that deal specifically with disability inclusion. So there's several resources that are shared in the guidance, and also some good practice that is already happening. The fourth criteria, it has to do with evaluation, stakeholder mapping, and data collection methods involving persons with disabilities and their representative organizations. I think this is the element in the guidance that has maybe the more thorough guidance. There's a lot of tools on data collection methods for involving persons with disabilities. And some of the discussions we had with the working group was kind of how extensive this guidance should be, how not to reinvent the wheel. And we have hopefully found the balance between highlighting the key points on this element number 4 on data collection, and also then providing the guidance so that the reader knows where to go to get further details. So here we also talk about or refer to the 7 principles of universal design, and we show them in the guidance. We look at how to explore pre-existing data sources. We look at how to locate diverse study participants and provide accessible recruitment materials. We look at how to ensuring disability disaggregated data, and that is also data that is disaggregated by sex and age. So let's hope that by integrating disability inclusion, we're not forgetting other important disaggregation criteria that we have already included before. We also talk about ensuring accessibility and reasonable accommodation. So, for example, considering using various formats, using language that is simple and concise, looking at whether the meeting location is accessible to all participants, looking at also what has been the trend the last couple of years, how to adapt digital and virtual meetings to also integrate disability inclusion. We provide a checklist for online surveys. What are the key things to consider? And a long list of tools, so you can look at those in the guidance, and hopefully this can remain a living document that we can enrich with upcoming tools and particularly good practices. So thank you, Nick. For the fifth element, it talks about evaluation findings and analysis, providing data and evidence on disability inclusion. And here again, the key considerations refer to including a specific section in the evaluation report that examines the extent to which gender, as well as human rights and disability inclusion, have been incorporated in the design and processes, and provides again resources and examples of current practice. The last element is the conclusion and recommendations of evaluations, reflecting their findings on disability inclusion. And this is very important because out of the conclusion and recommendations comes the management response that will, if the recommendations are looked at, then lead hopefully to more inclusive programming in the future. These were the 6 elements for the meeting the requirements. And now if we go to the last slide so that we have time to further discuss. In order, this slide has to do with exceeding the requirements, and very important here to take a minute to think about what it means that we have 0 entities that have yet exceed the requirements, and hopefully with this guidance, with the work that you are all doing, we can change the picture in the very near future. Nick, if we have the last slide, this has to do with the in this annual reporting process. And here we would like to see how the 6 elements that we have presented here and in the guidance, we can add a yes instead of a no in the checkbox, and at least we would like to see 4 out of the 6 elements that are met in order to meet the overall requirement. So this is all from my side in order not to extend myself and give time for the next presenters on what they are doing about disability inclusion, integrating it in evaluations. Thank you so much, and looking forward to the questions.
Thank you very much, Maria, for giving a comprehensive overview of the guidance there. I mean, colleagues, there are Maria has helped collect many very practical tools and applications for implementing the UNDIS guidance on disability inclusion. I look forward to everyone's reactions as they try these and implement them into their work. Thank you again, Maria, very much appreciated. So now for the panel, we promised a discussion of some practical applications of what has happened in organizations as they're trying to implement this guidance. And for that, I will turn it over to our first panelist, Catherine Aston from UNODC. Catherine, you have the floor.
Thanks, Nick. So thanks, everyone. What I wanted to do today is maybe share a little bit about what we've done to ensure disability inclusive evaluations and some of the lessons learned that we've learned along the way. The first thing I want to do is to say that one of the efforts we've made as an organization, UNODC, is to actually work with the Zero Project, which is an advocacy group for rights for persons with disabilities. And one of the things that they have suggested to us to make these types of events more inclusive is that we start out by describing ourselves and our background. So I will do that first. So as Nick said, my name is Catherine. I have brown shoulder length hair. I'm wearing a pink top with white polka dots and a white jacket. Behind me is a global map, a small cabinet, and a plant. So with that, maybe I'll just go to the next slide and tell you a little bit about our initial efforts. Okay, so initially, I think what we did is probably what most organizations did, is we sort of put disability inclusion in all of our templates and our guidance. So our terms of reference, our inception report, and our evaluation reports. And we did this for all of our evaluations, our project evaluations, in-depth evaluations, and our strategic evaluations. We had a real opportunity because at the same time, we were revising quite a few of our processes. And so we were able to pilot that as well as our other processes and sort of see how that went. And so that's what we did with those templates and guidance. We also have, we do quality assurance within our evaluation section, but we also have an external quality assurance process. And so we made sure to update those templates and instructions to ensure that all of our evaluation products were being reviewed for disability inclusion. We also, at the same time, within our evaluation work plan, we're developing a evaluator toolkit. And I think this is sort of aligned with what both Gopal and Medea were saying in terms of having evaluation teams that are familiar with disability inclusive evaluations. So we were developing a toolkit for evaluators on the specific mandate of UNODC. This particular toolkit was addressing evaluation of interventions on preventing crime and terrorism. And so we made sure to incorporate disability inclusive processes and guidance into that toolkit. And we also piloted that with an evaluation team through a couple of evaluations to see how it worked and if they felt that it was useful to them. And then finally, we were, for a variety of reasons, I think like many entities, were revising our evaluation policy. And so we made sure to embed disability inclusion and inclusive processes throughout the policy. So that's sort of where we are now in some of those initial efforts. And then I'll, if we can go to the next slide, I'll sort of address some of the lessons learned and what came from those. So what we want to do now is take the lessons learned from those pilots and also the UNEG guidance that's been now finalized to further those efforts. So we will be revising all of our templates and guidance, specifically because we found out that they need to be much more practical, as Medea was saying. So we want to include sample questions, stakeholder analysis guidance, as we know that's really important, and generally addressing intersectionality on universal design. We're also developing a new toolkit for evaluators on anti-corruption, evaluating interventions of anti-corruption. And we will include the UNEG guidance as a resource in there and include much more practical steps. That was some of the feedback we got from our evaluators when they piloted the toolkit, the last toolkit. So that's what we'll be working on. And then finally, we're updating all of our evaluation capacity activities. And one of the things that came out from our experience is that we'll be doing our evaluation capacity jointly with our program teams and our planning and monitoring RBM staff, because one, as much as we all love evaluation and think it's important, an evaluation training doesn't get a lot of traction. But when we sort of link that with our colleagues in monitoring and planning, as well as program, it's much more practical for staff, and it gets a lot more traction and more interest and sort of more practical questions. So we're also working on that. So yeah, that's it from me. That's sort of what we've done and where we're planning on going.
Thank you very much, Catherine. Appreciate you taking the time to share with us the perspective and experience of UNODC on the journey to disability inclusion and evaluations. Especially interesting the work on capacity building, sort of following from lessons learned on your inclusion of these issues in guidance and what's needed to make it more practically applicable. So thank you for that. Our next presenter is Naomi Asukai from the ILO. Over to you, Naomi, to tell us about ILO's experience.
Thank you, Nick. I'm Naomi Asukai. I'm from Japan. I'm an Asian Japanese woman. And behind me is a blue screen that says International Labor Organization. So it's just a normal Zoom kind of blue background of the ILO blue colors. So thank you for the opportunity to share our story, to share our experience with you today. ILO is a fairly newcomer in terms of having an office-wide policy on disability inclusion. So our policy came into effect towards the end of 2021. But prior to that, the Evaluation Office, following the introduction of the UNDIS in 2019, we embarked upon the first efforts to revise the guidance on our TORs. And we included in the annex a sample questions on how we can incorporate disability inclusion into the evaluation TORs. The ILO has a decentralized evaluation structure so that many of our project evaluations are actually undertaken by evaluation managers who are our colleagues in the ILO who are trained in the evaluation manager certification program. So one of the things that we also did over the course of 2021 is because we had to move the evaluation manager certification program from something that was in person on campus to a completely remote setting because of COVID-19, we were able to actually use that revision of the curriculum to also incorporate disability inclusion issues. So we had our first training in 2021 with a cohort of about 20 evaluation managers, and we plan to hold the second one online in April or May of this year. So we're hoping that the new cohort of evaluation managers that are coming out of this program are now sensitized to the issue of disability inclusion. As noted though, the ILO disability inclusion policy came into being in 2021. There was no systemic tagging of development cooperation projects or any of the activities of the ILO with a disability inclusion tag. That means that people were not sure, especially in terms of when we do the evaluations. People were not sure, are we supposed to do this to all of our activities now or only to those that have a specific focus on disability inclusion? So there was a bit of a confusion. We conducted the ex post meta-analysis of our development cooperation projects and found that less than 1/4, so 21% of projects that were evaluated in 2020 incorporated disability inclusion in the report. And this was the most poorly rated criterion across all the other criteria in the study. Unfortunately, when we did our external quality appraisals, so we sent all of our reports from project all the way to corporate institutional level to an external entity who checks our quality against ILO, UNEG, OECD DAC criteria. They also found that only 28% of our reports were satisfactory in terms of disability inclusion, and that 71 of our reports scored below somewhat satisfactory. So very specifically, 65% of our reports were rated highly unsatisfactory in this domain. Now, the good news is that we have significant areas where we can make improvements. And the new UNEG guidance actually provides us with concrete examples and very specific sample questions that we can use to revise and adapt our existing guidance materials. It also gives us references and ideas on what the other organizations are doing. And I'm very happy that it includes non-UN family organizations, but experts outside also who are doing work on this, who could also provide an external view of our perhaps revised products. So whatever we revise, maybe we can team up with some of these other organizations to have them kind of do like a peer review of our work. Now, some of the next steps that we have planned are to look into incorporating universal design into our knowledge products and evaluation products. We want to continue to revamp our training materials. For example, we also have a module for consultants who would like to work with us in evaluation. So we have an online small briefing course for them. And we are looking to include disability inclusion in that online course. As you see, there's a table with 7 rows and 8 columns. Now, the 7 rows on the left-hand side are actually all of the cross-cutting themes against which our evaluation reports are rated as having been successfully or unsuccessfully incorporated. So this table summarizes what I said earlier about the fact that 65.2% of our reports were considered highly unsatisfactory in terms of including considerations for persons with disabilities. But the table also shows that we have 6 other cross-cutting themes which ILO evaluation reports are expected to include. Now, some of them are very ILO specific, like tripartism and social dialogue, international labor standards, but some of the others I'm sure you also have is environment, gender, SDGs, COVID-19, and also then the inclusion of disability considerations. So one of the challenges that we face, and I'm very happy to hear that Gopal says he's met many evaluators that have experience with disability inclusion, and because we're looking for those people. And it is harder and harder to find evaluators who are evaluation experts, who are subject matter experts, plus have a notion or have experience in all 7 of these cross-cutting themes. So I really look forward to continuing our work in this working group to share ideas, but also to hear from you today on other ideas that you may have. And Mireya already talked about a list that we can share amongst each other. And I think I'd be very interested to take some of that and put them into practice. So thank you.
Thank you very much, Naomi, and also thank you, Catherine, both of you for sharing your experience very much of learning by doing, your organization's experience of learning by doing. Just a few questions here we have ready. Following on this learning by doing approach to disability inclusion evaluation, I think we are all of our organizations are in a similar situation. You know, any thoughts on what practical steps you'll take next, either in terms of training or where you see the UNEG guidance really helping out?
So, I mean, I don't want to in any way apply that I have an answer to this or that we really know what we're doing. But I think looking through the guidance and seeing where we have gaps, the guidance really fills in those gaps for us. So when we look at our templates and the guidance that we've already revised, it's clear that we need to be much more practical. And this is, again, the same feedback we got from the evaluation teams who piloted our toolkit for them. Because I think Naomi and Gopal and Mireya all highlighted how important it is to have evaluation teams that have an understanding of disability inclusion. But for us, it's also really important that they understand the mandate of our organization. So I think using the guidance to give practical sample questions, how to do a stakeholder analysis that is inclusive, all of those things I think are going to be a huge benefit to us if we can then include those in our guidance. And then maybe that helps build up this roster of experts who know how to conduct disability inclusive evaluations.
Thank you, Catherine, for that. Very much looking forward to seeing what UNODC and others do in that regard, sort of practically applying. Another interesting and probably really important question is the issue of sort of intersectionality. These disability groups are also a disadvantaged or difficult to reach element of society, and this will often coincide with other groups. Wondering, colleagues, if you've had any observations about the intersectionality of this cross-cutting or mainstreaming issue with others, for example, gender or Aboriginal groups, or those left further behind. Catherine, Naomi, or Mireya as well, in your experience. And while we're waiting on that, we have a question, I think, from Monica. Monica, please, you have the floor.
Okay. Well, in fact, I wanted to contribute if I can. I'm new in this working group, but I've been trying to push the agenda on gender. And I think the question that Nick already just mentioned of this intersectionality and the expertise of consultants and our own expertise, I think sometimes we are asking a little bit too much because we are adding more and more layers that of course are very necessary, as Mireya presented, but I think we have to find a good entry point, and it depends on the context and the project and even the focus of our own organization, no? Like talking from IFAD perspective, I think all the work that has been done to try to really integrate gender. I think we should capitalize, and maybe our entry point, I'm not saying that this is the case for everyone, in this call and elsewhere, would be like women, and then we try to see like what are like people living with disabilities and how to integrate it. But yeah, I think the bottleneck, as also Mireia mentioned in her presentation, is always data, because as evaluators, we usually come at the end. And sometimes we find projects that are mentioning these kind of vulnerable groups, including people with disabilities, but then no one did anything during monitoring, or even there is no buy-in from project implementers about targeting them. So it's I think even if we have all those guidance, which are like useful and necessary, the real challenge is way bigger than that. I don't want to be pessimistic, but yeah, I think it's good to integrate it in our evaluation, but we have to be really conscious that context matters a lot, and also what we find when we go to evaluate is also very, like, it's a big constraint that we find. At least that's my experience. Thank you.
Thank you for that intervention, Monica. Very good points indeed. Colleagues, I'm conscious on time. It's just the top of the hour now. Mireia, over to you for final thoughts before we finish up.
Thank you. No, I'm glad that we finish on this discussion. It could take us another 4 hours or 4 weeks to find a way forward. But I think, Monica, you summarized it really well. And I think kind of what in the guidance, what we try to do is to really find this balance between we know that women and men are not homogeneous group. So how can we look at sex and age when we're talking about data as the two universal determinants, and then understand what are all the other identity markers that will describe who these men and women are, and what are their needs and what are their capacities. So I'm just going to leave it here, and yeah, thank everyone for the participation today. Over to you, Nick.
All right, thank you, Mireia. Of course, colleagues, thank you all for taking the time to be with us today as we present this guidance, and thanks, of course, to our presenters and everyone who contribute to development of the guidance, either on the GEDHR working group or if you submitted thoughts as well. Those were used. So thank you once again for taking the time. We're looking forward to hearing in the future how people use the guidance and what your experience is as we work. Learn by doing, I think, is probably the most appropriate theme of this session as we work to apply what we can in order to implement this criteria in our evaluations going forward. Again, thank you all, and I understand the recording for this and presentations will be made available for sharing after the fact. Thank you, colleagues, and wishing you all a good afternoon, good evening, and good morning for some of you.